So, a recent study put out by Blue Cross Blue Shield, which is one of the biggest, if not the biggest, health insurance companies in North America, they released this detailed study stating that for the average person, a major health decline begins at age 27. And if you're like me, like that is a shocking number. That's a shocking statistic. So if you're the type of person who values your health and you want to have good enough health to, enjoy your life and be able to choose what you do, living life on your terms versus having poor health, and your poor health choose for you what you can or cannot do, please watch this short video for action steps so you don't fall into this trap now that has the average person starting to lose their health by age 27. To quote from the study, Blue Cross Blue Shield Health Index data underscores the urgency for the healthcare community to recognize that North Americans are experiencing a double-digit increase in the prevalence for 8 of the top 10 health conditions, with younger generations facing health challenges at earlier ages than previous generations. And they say this will have a substantial effect on the economy over the next 2 decades, including workplace productivity and healthcare costs. Now, obviously, being a insurance company, they're worried about costs. But I want to highlight what this means for individuals and their enjoyment of life, as well as what do you do to be on a different path to get better results? Because, like, to highlight what they said, like there's double-digit increases in 8 of the top 10 health diseases, and younger generations are seeing problems earlier and more severe than previous generations. We are clearly on the wrong path if this is what the stats show, especially from a health insurer. So a truth like this, that disease is starting to deteriorate early in life and all the major diseases are increasing, just underscores the reason that we need a different healthcare model, a real healthcare model, not just an emergency and crisis care model, which is what our medical system is. Because with those numbers, like I said, it's clearly not working. The lie that people have been led to believe, and the biggest disservice I feel that medicine has done, is telling people, don't worry about your symptoms, whether it's, your high cholesterol, your blood pressure issues, your diabetes, the pain in your neck, etc. Because they say, don't worry about it because we have a pill for that. Where there's never any discussion about how to actually address the actual cause, because why would you need to, right? We have a pill to make you feel better, or a pill to make the number look good in our test, so you'll be fine. But whoops, turns out doing things that way means that you start a health decline at 27 years old, right? That will result in you not being in control of your health and not being able to live life the way you want by your 40s, 50s, 60s, and further, if you make it that far, right? BJ Palmer said, while other professions are concerned with changing the environment to suit the weakened body, chiropractic is concerned with strengthening the body to thrive in any environment. The solution to this and numbers like this is to get curious, asking why. Not how do I get rid of this symptom, or how do I get this number to change, on my test, but why is this symptom showing up? Why is my body responding like this? Not what pill do I need to take for the symptom to go away, then I'm going to get better, right? Because like no one wants more medications in their lives, right? Like no one wants that. But until we make a change in health that looks at cause and addressing why health concerns show up versus just trying to make the symptom go away, you are never going to have control or really be in the driver's seat of your health. And that is what we do, and what Maximize Living is. We pride ourselves in this model that addresses the cause and actually builds health and can be implemented into any lifestyle, and it's sustainable for a lifetime to actually get you the results you want now and decades into the future. So for patients, make sure you keep your adjustment schedule and you do your home care exercises, because we know the facts are that the nervous system is what creates health. It's what controls all the function of your body. So don't try and take shortcuts, right? Like these shortcuts, like if things are busy, I'll skip it today, I'll move it to next week, right? All these shortcuts, it takes you down a road that you do not like the destination of. If you do get off track, this is when you lose momentum. And when you lose your way is when you get into trouble. So if you've gotten off track, reach out to us and we will help you get back on a better path to get better outcomes. Either to, get to, or I want you to make sure that you, like our upcoming workshops or advanced workshops, make sure you get to them or on them at least, so you know how to implement the lifestyle changes to support health versus the shortcuts that, take you to increased disease that they're talking about in the study. So when it comes right down to it, true health is all about the 5 essentials. These are the 5 things that, if done properly, can build and add to your health, but if done poorly, they can take away and subtract from your health, right? And then after you do that, help others, right? Whether that is you working on yourself so you become this glowing testimonial and people start looking to you for support as their beacon to health, or help those who you care about to, set up an appointment to get an exam or to get on one of the advanced workshops so they can start building health again, because they can't wait for you to get the greatest change before they get on a better path and actually start rebuilding their health so they have a better life. I guarantee they will thank you for it. So if you want to make a difference in the world, it starts with one person at a time. So I encourage you, make sure you have this mindset for your health. Encourage others to do the same. If you do not want to be part of these stats, and you don't want to have a life that has your peak at 27 and then a massive decline, like look at that chart, like it plummets after 27 in your ability to really enjoy and experience life, right? We are here for you on this journey. Just ask us for help.